ADHD is deceptively complex. When I first went into assessing these in my psychology practice, I thought it was going to be an easier part of my work. I quickly learned that it was not. It's quite complicated, and I've learned over the years that it takes quite a complex assessment to really understand what's happening to the person who thinks they might have ADHD. I'm Dr. Sira. I'm a clinical neuropsychologist. I've been working in clinical neuropsychology for about 15 years, and I've been doing ADHD assessments as a focus of my practice for about the last 5 years. I wanted to take a little bit of time to talk to you about how to get the best out of Hyperfocus to assess people who come to you for an ADHD assessment. A lot of people are coming into this area of assessment, psychologists, physicians, nurse practitioners, mainly because the demand for ADHD assessment seems to keep growing. More and more people are offering the assessments, but it doesn't seem to be stemming the flow. I think that's because ADHD, not only is it a common condition in the general population, but it resembles a lot of other conditions on the surface. I have a hard time getting a good history from them in the clinical interview. What I've learned is they have a very difficult time giving me a complete history. They have a hard time remembering important details, and they have a very hard time sequencing their history in order of temporal occurrence. I think that may be part of their problem. They have this executive problem that gets in the way of organization of their memories. This was making it hard for me to collect a history in a reasonable interview, and I wanted to be able to get all the information I needed in less than a 4-hour interview. Because best practice suggests that we should interview an informant who knows the person well, ideally who knew them in childhood. When we're trying to diagnose ADHD, I really wanted to capture that information. I have found it's very difficult to collect information from informants. It was difficult to schedule, and it took multiple phone calls, and by the time I actually had the interview with them, I really was only able to capture a fraction of what I wanted. And that was not satisfactory either. It took far too much time for very little gain. I really want to do a good job. I want to be able to tease apart the complexity of what the person is telling me to understand what diagnostic possibilities are present. To do that, I have to get a full history, but I want to be able to do that without spending upwards of 4 hours talking to the person. I also want to get information from an informant without having to schedule a separate interview. Like I said, ADHD is complicated, not because the condition itself is so difficult to observe, but because it resembles many other things on the surface. What I mean by that is many roads lead to poor attention. So someone might come to me and they say, I procrastinate, I can't pay attention, I'm scattered, my sleep is poor, I really think I have ADHD. They might have ADHD, but they might also have an anxiety disorder or a sleep disorder, or they might be using a lot of cannabis. There could be many reasons their attention is poor, and it's my job as the expert to rule in and rule out all of the possibilities completely. A standard way of assessing ADHD is through questionnaire. Sometimes people do a cognitive assessment, but I'm not going to talk about that today. I'm mostly talking about self-report today and the observations that we make in the interview. So when we have someone come into our office to do questionnaires, that's fine, but that takes hours. So instead, a physician or a psychologist will often send questionnaires home with the client to complete on their own. We may also send them forms to give to an informant on their behalf. I've learned that it's very difficult for people to complete those questionnaires in a timely manner. They are coming to me because they're disorganized after all, so it's kind of understandable. And that was very difficult. I was having a hard time getting all my completed questionnaires back in a timely way so that I could score them and understand the results before I met with them, which is my preference. I wanted to be able to have that information in hand before I met them, and so I was asking for that, and then I was scrambling to get it before the booked interview. They might send it to me the day before, and my assistant would be trying to score it that night to give me the results. It was a disaster. So I thought I might have had a solution when I switched to online practice software. The software could send questionnaires out for me by email to the person. And that was okay. Sometimes they would complete them online. But what I learned was that the software I was using would score it, and I would get a number, but the number was not meaningful to me. And it wasn't actually attached to the normative data that would have been connected to that particular questionnaire. So I didn't find it very helpful. I still had to, sometimes I'd have to go to the articles, but I also sometimes had to make a spreadsheet, just like I used to do when I was scoring it myself. So I did not find that saved me time. I also want these questionnaires to be scored in a meaningful way. I do not want to be given a single number or several numbers in the abstract. I want the number to be connected to the norms and interpreted on my behalf. I want to be able to quickly see what that number means so that I can take all of those questionnaire results as that single point in time look at how that person is doing on that day and understand at a glance what might be going on for them right now. So you know what else I found really frustrating? So you might have an administrative assistant, I do, and we would book these appointments well in advance because like you, I have a long waiting list for the assessment. So we would book these appointments well in advance, which you would think would give enough time for the person to do everything they needed. But because they are coming to us for ADHD assessments, sometimes they don't get all the stuff done in the time that they needed. And sometimes it's long enough that they've actually forgotten about the assessment. And then we're having to remind them and chase after them and all of those things. The other thing I found when I was using practice software to send questionnaires was that it was quite confusing for the clients. They would get an email with a long list of questionnaires for them to complete. And they often didn't know which ones they had done and which ones they still had to do. And that wasn't easy for me to see either without going into their file and directly looking. And so I would get confused clients emailing me, and I had to spend more time explaining to them what they needed to do. I want to be able to send clients questionnaires in advance for them to complete in their own time. I also want them to have a very clear way of seeing what they have to do, what they've already completed, and what remains to be done. I want to be able to prompt them if they've forgotten all about the assessment, for example, quickly and conveniently. This really helps them complete the assessment and get closer to the appointment date, which is what they want. I want them to do it comfortably in their own time, whenever they have a minute, and I want it to feel client-centered. What we really want for you is to help you adjust your assessment practice so that you can have both speed and accuracy when you're doing your assessments. We want this process to be helpful to you as a practitioner, and we want it to be client-centered so that people feel supported and understood at the end of the process. To accomplish this, we've combined online tools with many years of clinical experience to create a process that allows us to be both accurate while also being quite speedy and efficient. This process is very supportive to the practitioner, you and me, but also very client-centered so that throughout the process, they feel supported and eventually very well understood. We want to let tools do what they're good at doing, which is administrative work. And we want to let you, the practitioner, really reserve your time for what you are good at and what you were trained for, namely diagnostic assessment. Whether you're a psychologist who can deal with any level of complexity, or you're a nurse practitioner or a physician who wants to be able to quickly and efficiently assess the bulk of people who come for an ADHD assessment, while also recognizing through the software flags those clients who are more complicated and need a deeper assessment so that you don't worry that you might miss something quite important. We want to support people who are seeing these clients in all sorts of different clinics, whether it be a medical clinic, psychology clinic, or even a hospital-based setting. As a neuropsychologist, I genuinely believe that everybody deserves a good assessment. We want to find a way to give everybody access to an expert assessment without creating a financial burden and without taking up hours and hours of time for the assessor. This approach gives those people access to a comprehensive assessment that is not only timely, but also quite cost efficient. In my opinion, this moves me and maybe you towards the goal of equal access for all. We believe mental health and well-being is a right, not a privilege. Hyperfocus is a little bit different than typical administrative practice software. Practice software is very useful for the clinic and it's good for scheduling. So in that way, it's helpful for the practitioner. It's not so helpful, in my experience, for the client. What we wanted to do was create a process that was very helpful for the client to give us the information we need, because that saves us time. We also wanted it to be more helpful to the practitioner in terms of clinical expertise. We wanted to be able to provide some intuition and some suggestions to clinicians who are very knowledgeable, and I respect that, but also often working under time constraints. And so I wanted to find a way to use software to help me save a little bit of time by prompting me to think about issues that maybe I might not have noticed. So use the history forms at the beginning of the assessment. Once the clients see these history forms, which are broken up so as not to be too overwhelming, they really start to understand that you're casting a wide net. You're trying to rule in and rule out all these different options that can present as ADHD on the surface. In my experience, while these questionnaires are in depth and go quite deep, clients really appreciate that. They feel very heard by the time I meet them. They are grateful for the opportunity to really tell their own story and take as much time as they need. Some clients write a lot, some clients write a little, some clients write a lot. I read it all because I'm interested, but highlights will stick out if you don't have time to read it all. Finding a way to give the client an opportunity to tell their story is a gift. And that's one of the things that people tell me they appreciate most about using this software. One of the most interesting things about providing a very detailed history form in advance is that it helps clients grow insight before I've even met them. Through my questions, they start to recognize their own patterns and maybe how their history, often of trauma, is quite relevant in their current functioning. And that too is really helpful for me once I start the assessment. I believe everyone deserves a good assessment, but I also really want the process to feel fair to the clients on my waiting list. So I used to book people in the order that they came to me, but I don't do that anymore. Now I open up my wait list, I send everyone consent forms, we sign them all up to Hyperfocus, and their appointment date depends entirely on how quickly they finish the forms. We send out history forms and they complete them in their own time. And some people do that very quickly and some people take a long time. That tells me how urgent the assessment is to them. Then we send questionnaires and they complete those in turn. Only when the questionnaires and everything is all finished, I book the appointment. Hyperfocus sends me a lovely little notification to say everything's done. I go in and check, make sure I don't want anything else, and then the appointment gets booked. And that feels fair to me because people have been waiting a long time to see me, in my case, and I want to make sure that I respect the urgency that they are telling me they're feeling. Best practice says we should be interviewing informants who know the clients well. Ideally, one who knew the client all their lives in childhood, and maybe a current informant like a spouse. I wanted to be able to do this conveniently without scheduling separate interviews, and I wanted to be able to do it in a way that didn't feel too intrusive to the informant. Hyperfocus does allow that now. It allows us to send questionnaires to an informant identified by the client. So remember, psychologists, nurse practitioners, physicians, you're professionals and you want to do a good job. Like me, you're busy, and so you want to be able to do a good job and do a comprehensive assessment without spending hours and hours on the assessment. We want to be able to get comprehensive information and make a diagnostic conclusion without sacrificing accuracy or speed. Here's what I want you to do. Now that you have Hyperfocus, you have a tool that's going to help you complete your assessments both quickly and accurately. I want you to look at your process for assessment and see if there is any adjustments that you might be able to make that could save you time and increase the experience and the positive benefits to your clients and patients. You might want to adjust your clients' expectations on what an assessment can look like. If they are expecting to spend all day with you, you might need to let them know that that's not how you do it now. You might need to adjust your own expectations of what an assessment has to look like. If you were trained to spend all day with someone, it might feel strange to come up with an opinion after just a couple of hours in an interview. These expectations are what we're used to, but it doesn't mean it's the best way to do it. You might want to adjust your expectations with your clients through your consent form, like I do. My clients understand that they are going to be completing a great deal of information before I meet them. And so by the time I meet them, there's no surprises. It's also helpful to let your clients know that their scheduled interview depends entirely on them completing the forms. This gives them an incentive to complete the forms and allows you to just get on with all your assessments. And now you get to consider what you're going to do with all the time you save. If you're like me, having shorter assessments and shorter reports allows me to see more people. And so I'm able to get through my wait list more quickly and also do all the other jobs that I do without writing reports all weekend. Who wants to do that? You may decide that you're going to do something else instead with your free time. This is the beauty of Hyperfocus. It gives us free time and we get to decide how we're going to use it.